name is Dr. and I'm the medical officer here in Duchess International Hospital. So I'll be starting the presentation on our contrast-induced nephropathy. We had a case presented to us on the ward today. Now, background about this patient: he'd been diabetic for 15 years and was recently diagnosed hypertensive a month prior to presentation. He'd had cholecystectomy done on account of gallstones. There was a 30-pack year tobacco use and also history of alcohol consumption.
Good morning, everyone. Thanks for having me. Odile Peter Jr. is my name, and I'll be presenting on contrast-induced nephropathy, the radiographer's perspective. This, as we all know, is a dye that is used for radiology investigations. It helps in enhancement of the structures, the vessels, and every other structures in the human body. For radiology, I'll just limit the contrast to just the two major contrasts we use, which is used during the CT scan and the MRI scan.
I'm presenting contrast-induced acute kidney injury. We call it the silent threat behind the image because of the threat to the kidney. You don't want anything that will affect the kidney. So, because everybody is now requesting for CT coronary angio, CT contrast, people are not thinking of the affectation of the kidney. So, I'll be discussing based on this, following this outline. The most important aspect of this lecture: you must risk stratify your patients. The risk factors can be divided into patient-related risk factor, procedure-related risk factor, and contrast-related factors. So patients with pre-existing chronic kidney disease have a highest risk factor, followed by patients with diabetes mellitus. So studies have shown that the first two are the people we label high-risk patients. And our index patient has been diabetic for 15 years, though he doesn't have diabetic nephropathy. Assess your patient very well. If this patient is dehydrated, postpone the procedure. Tell the patient, go and take water at least for 3 hours before the procedure. Because that hydration, we have to expand. We want volume expansion. And when there is volume expansion, it will help in the elimination of this contrast.